Hello guys, this is me Dr. KashanQasit. Today here we were discussing the ECG patterns. In previous lecture we have discussed the atrial fibrillation. Today we are going to discuss another topic which is atrial flutter. So basically atrial flutter is the type of supraventricular tachycardia in which there is a succession of rapid depolarization of atrial waves, and this depolarization of atrial waves is so rapid that it leads the atrial rate greater than 250 beats per minute. So basically it is a macro re-entrant phenomena within the atria. So this is causing the atrial rate to be increased greater than 250 beats per minute. So this should be distinguished from the focal atrial tachycardia in which the atrial rate is within the rate of 100 to 250 beats per minute, and it involves the micro re-entrant phenomena. So this is the difference between these two. Now we are going to discuss the etiology and further about the atrial flutter. So basically in atrial flutter there is a rate I have discussed earlier greater than 250 beats per minute. So the atrial rate is greater than 250. Likewise, I have discussed earlier, it is within the range of 100 to 250 beats per minute in focal atrial tachycardia. So the difference between both these is, this is atrial flutter and this is focal atrial tachycardia. This is the difference, and it involves here, atrial flutter involves the macro re-entrant phenomena within the atria, while this involves the micro re-entrant phenomena. So now we are going to discuss in detail about the atrial flutter. So the reasons or the causes for the atrial flutter are exactly the same for atrial fibrillation. So for the causes or the reasons for atrial flutter, you have to look at my previous lecture or video which is about the atrial fibrillation. So moving next towards the important point, which is regarding the ECG finding of the atrial flutter, which is usually sawtooth pattern of P wave, which is usually seen on the ECG paper, and this is usually better seen in lead 2, lead 3 and AV F. These are the leads in which this is better seen. This pattern of sawtooth is better seen in these leads. There is another change in the ECG which you will see is there is a narrow QRS complex and the rhythm will be regular in this case. So until now we have discussed the rate of atria. So the ventricular rate will also be different in this case, and it all depends upon the type of block, that is 2:1, 3:1 or so on. So if the block for example is 2:1, the ventricular rate here will be 150 beats per minute. So whenever we are discussing the atrial fibrillation or atrial flutter, we always discuss the atrial rate, but here the ventricular rate is also important. So always keep in mind about the ventricular rate. So this was all about the atrial flutter. We have discussed the basic definition, then we have discussed the atrial rate, and finally the ECG changes seen in the ECG paper. So in the next video we'll be discussing some other topic of the ECG pattern. Hope you like my video. Thank you very much for watching. I'll see you in my next video.